we are going to move on to our discussion of prostate cancer to talk about the impact that it has on not just the patient's life, but the life of his family. We want to talk about what's going on with that disease as far as treatment, not only the physical side of it, but the mental side as well. And I can't think of a better person to do that than Dr. Zach Clausen. He's a urologic oncologist at the Georgia Cancer Center right here in Augusta. Dr. Clausen, thanks for the work you do, and thanks for being here.
Brad, thanks for having us. Good to be here.
You look at the stats on prostate cancer and you come to the conclusion, and this is a little bit of an overstatement,
sure,
boy, if you live long enough, you're going to get it.
Yeah, absolutely right, Brad. So 1 in 7 men will get prostate cancer. 1 in 38 men will die of prostate cancer. So you can see there's a high incidence, people getting it, but also high prevalence. So not everybody that gets prostate cancer dies of it, thankfully. But we have a lot of men in the community that are living with prostate cancer.
There are, if you again look at the charts, more people who get it as you get older. So my question is, at what age should we start that screening?
That's a great question. So there's been a lot of debate in the lay media about when we should start screening.
Right.
As the American Urological Association company and a program that we're part of, we recommend that men should think about getting screened usually between the ages of 55 and 69. Now there's a little variety in that in the sense that if you have a family history, we may screen you a little bit earlier. But that's really that sweet spot where we think about screening men.
And when you say screening, you mean the full-on PSA test?
Yeah, so there's 2 ways that we screen for prostate cancer. One way is the PSA blood test, like you mentioned. The other way, and this may sound a little bit morbid, is we do a rectal exam where we actually feel the prostate.
Right.
And this is important because some men may have a normal PSA, but their rectal exam will have a nodule, and that'll lead us towards suspicion of possible prostate cancer.
Is there something we can feel or detect that might let us know something is wrong? Sometimes if you have trouble urinating, you think, oh my goodness, I definitely have it.
Right. And thankfully, most men that have difficulty urinating, and that happens in a lot of men as we start to collect birthdays, these men typically don't have prostate cancer. They have what's called BPH. This is a growth of the prostate, a benign growth. So for asymptomatic prostate cancer is the most common presentation. So that's why we have to detect it on the PSA blood test or the rectal exam.
If you detect prostate cancer early enough, can you cure it?
Yes, we can. So there's a process that we go through. We call it shared decision making. So we usually get men that are referred to us with a PSA, maybe a little bit elevated. At that point, we may repeat the PSA to make sure that it is truly elevated. If we think that there's an indication for a biopsy, then we'll have a discussion with the patient, their family, and we'll decide if a biopsy is warranted and what that entails. So at that point in time, when we do the biopsy, if men are diagnosed with localized prostate cancer, there's treatments that we can do and we can cure them of prostate cancer.
And how long does that usually take from that first scary news in your office
right.
to, I can't believe it's all gone?
So we try to get men in as soon as we can. So when we get a referral at the Georgia Cancer Center, we try to get them in as quickly as we can so that we can alleviate concerns not only of the patient but also their family. And we try to make a treatment plan initially. So if we see somebody in week 1, we try to schedule a biopsy, usually within a week or 2. And then if we unfortunately have a positive biopsy, then we discuss treatment options. This may include surgery. We do these surgeries typically with the robot, so we're controlling the robot, and this helps us takes the prostate out minimally invasively. The other option is, and some men choose to do radiation therapy, which is also a very good treatment for localized prostate cancer.
Where you just try to zap the tumor?
Exactly.
Okay.
So you treat the whole prostate, but you basically treat it by zapping it.
What about the involvement of the family? How key is that when it comes to helping a man get through this whole process? Because it is scary.
For sure. It's a huge aspect. So we're at the Georgia Cancer Center, we're big on the family aspect.
Yeah.
So when we're talking to patients, we're not just talking to the patient, we're talking to their wife, their child, their nephew, their grandma. We try to get everybody involved who wants to be involved. And I think, we see that men, they can take time to make a decision. So the nice thing about, I shouldn't say the nice thing, the fortunate thing about prostate cancer is we don't have to make a treatment decision that day. It's important to talk to your family members, to your church members, people that have gone through the treatment before to see what the side effects are of the treatment.
Is my first stop my urologist or my oncologist? Should I go straight to the oncologist to try to expedite this whole thing, or must you go urologist first?
It's a good question. So we have great relationships with our medical oncologists. We love them at Georgia Cancer Center. Typically, when it's a localized prostate cancer, they come and see us first. And most of the time, if it stays localized, we'll continue to see them typically for the rest of their life. If unfortunately patients progress to where the disease spreads or becomes metastatic, at that point we'll usually get our medical oncology colleagues involved.
Is there anything I can do if I'm not genetically predisposed to prostate cancer to ward it off? Lifestyle changes or habits?
It's a good question. We've been looking at diet, we've been looking at obesity factors, and there appears to be some association between these, but there's no concrete evidence at this point. I always tell men that even though there's a high chance of getting prostate cancer, there's still a greater risk you're going to die of heart disease. So anything you're doing that's good for your heart, exercise, diet, not smoking, etc., those things are also good for your prostate, because that's still the #1 killer in men. So we talk about the whole health plan in that regard.
You know, we talked a lot about our servicemen and women in our first segment.
Right.
Are you still seeing veterans come in who may have been exposed to something out in the field, in the trenches,
Sure.
that's led to prostate cancer?
Sure. We've at Augusta, the Augusta VA, which is just across the street from the Georgia Cancer Center, we were pioneers. Well, the people before me, I should say, were pioneers of doing research looking at a possible link between Agent Orange and prostate cancer. Agent Orange was very common, as most of our viewers probably know, in Vietnam, and so there were some initial studies that suggested that there may be a risk associated with prostate cancer after Agent Orange exposure. These studies are still ongoing. It's hard to always prove a causal association between one thing and another, but there appears to maybe something to that story.
What about some of the fears that are out there? And you're hitting on a part of the body that can generate a ton of anxiety and fear
Sure.
in men and the people who love those men.
Sure.
So what about fears like, I won't ever urinate the same again, my sex life is gone?
Yeah.
What do you say?
These are great questions and great points, and we discuss this in detail when we're talking about the treatment options for men. So we can cure prostate cancer with this localized treatment most of the time. In the men that we cure it, there is side effects to these treatments, and these are important. So as you mentioned, sexual dysfunction, urinary incontinence where you leak urine unexpectedly. Usually with surgery, these are more drastic up front, and then they progressively get better, and sometimes we have to give medications to help with sexual function. With radiation, usually this function is okay up front, and typically it does deteriorate a little bit over time. So these are very important issues, and we're active in treating them, and we have partners within our Georgia Cancer Center group that also treat these patients specifically as well.
Well, and one of the great things that you do and that the folks at the Georgia Cancer Center do is address the mental health aspect of all of this. So
Sure.
what is that approach? What does it entail when you're treating the whole person?
Yeah, it's a great point. This is a passion of mine. I really think that it's an understudied topic and risk factor, not only in prostate cancer, but all types of cancer, bladder cancer, lung cancer. This is a really an important topic because it's only recently, over the last 10 or 15 years, become kosher to talk about these sorts of things. So we're finding that, not surprisingly, men that are doing well in their 50s and 60s, sometimes their 40s, are diagnosed with prostate cancer, and they're probably going to live with this prostate cancer for the rest of their lives. They may need treatment, they may not. However, this is the mental fatigue, and this is what we're focusing on. So we've done a couple of studies using big databases in the United States, looking at patients that have had a prostate cancer diagnosis and their suicide risk going forward. Mm-hmm. Unfortunately, it is elevated all the way through this process, even after 15 years. So that tells us that, sure, the suicide risk increases as men get older, but also there's probably something related to the side effects of treatment, or just the burden of that cancer diagnosis.
And so do you try to link them with mental health professionals at that point to get them through that, we hope?
Absolutely. We're trying to certainly increase our associations with our psycho-oncologists, and this is important for sure. We're even trying to get some of these patients, the first time they see us, we're trying to get an initiative where we can get them in to see the psycho-oncologist early.
Psycho-oncologist, somebody who knows everything about cancer and the brain.
Exactly. So
Yeah.
these are excellent colleagues that we have that will talk to the patient, really get to the root of how they're feeling. You know, we're urologic oncologists, we treat the prostate cancer, but there's so many other things associated with this. So working with our colleagues in psycho-oncology, they're going to ask about depression, they're going to ask about suicidality, they're going to have the family involved, and these are all important aspects to sort of treating that whole patient, specifically from a mental health standpoint.
Well, Dr. Clausen, you've seen this whole process unfold probably daily, if not monthly in your life. What can you say to offer people hope? What if they're in that dark place that is the initial diagnosis? You've seen somebody come out of that dark spot,
Sure.
right?
Absolutely. So the prostate cancer diagnosis is something that, we will walk through the process with you, explaining what this means. There's a large spectrum of patients that get prostate cancer. Some men have local low-grade prostate cancer. We'll watch it carefully. They may never need treatment, and we'll continue to follow them carefully. Some men are in that medium box where they're going to need treatment. They may have side effects. We're going to treat them as well. Some men are going to present with aggressive disease. Those are the ones that are the tough ones. We're really active in getting them in clinical trials and getting them as much treatment as we can up front. So to answer your question, yes, we can work with you no matter where you are on that spectrum. We'll take care of you. We will be able to cure some people. Unfortunately, we can't cure the ones that present with advanced, really aggressive disease. But the treatments that are coming out, especially for these patients over the last 10 years, has really improved not just quantity of life, but also quality of life.
Yeah, the advancements have just been incredible. Thank you for what you do. You do
My
change
pleasure.
men's lives and take them out of that darkness, and I appreciate that.
Nice. Thanks for having us.
Absolutely. Dr. Zach Clausen, Georgia Cancer Center. Go see him. Go see your doctor and take that first step. You heard him say at the beginning of the interview, the earlier, the better.